Hello, welcome to this NMC OSCE tutoring video. My name is Hannah. I'm a experienced UK registered nurse, a university lecturer, and I've been an NMC programme lead in the past. And I'm sharing with you lots of my information and teaching on the NMC OSCE to help you self-study and hopefully succeed and pass in your exam. So today I'm continuing with my APIE series. So I'm taking each APIE scenarios and talking through the condition, what to expect, looking at key assessment priorities, going through a example care plan and looking at some of the common medications that come up, as well as some recommendations that you can make in your evaluation SBAR as well. So please like and subscribe my videos and share them if you find them useful, and continue to put your comments in the videos as well. Try to answer them as much as possible. So today I'm going to talk through the community APIE scenario and what that involves and what the normal patient presentation is and the areas that you need to address. So the community APIE scenario is one of your 12 potential scenarios if you are completing the adult OSCE exam. And typically in the NMC scenario, it is a person who's got diabetes and it's set within the home and the community setting. So just a refresh, remember there are two different types of diabetes, type 1 and type 2. Type 1 is your insulin dependence. This is where your body is not making any insulin production and you need to administer insulin. And type 2 is you still have insulin production, so your pancreas is still making insulin, but your cells have become resistant to it. And this is normally managed through things such as diet, exercise, and oral medication. And it's very much a consequence of lifestyle changes over the years. Whereas type 1 is an autoimmune condition which occurs from childhood normally. There's nice guidelines on diabetes management, so a really good resource for you to read up on and familiarise yourself with the UK management of diabetes. So there are complications with diabetes and long-term diabetes as well. And it's good to know some of these because it might influence your assessment station and some of the presenting conditions with your patient. So you can get microvascular complications. These are in your small blood vessels, and then macrovascular complications. And the key microvascular complications are retinopathy. So this is damage to the retinal cells. So this could result in some vision or sight loss. You also get neuropathy, so this is damage to your neurons, so you can get pain, reduced sensation, impaired wound healing, reduced mobility. So those key things are really essential that we're assessing for some of those things within our assessment station. Pain, maybe impaired wound healing, reduced mobility. And then you get nephropathy, so this is damage to the kidneys and a reduction in renal function. And some of the macrovascular complications are things such as stroke, for example. So in your NMC OSCE scenario, like I said, it's a community-based, you're visiting a patient in their home. We need to think about that community approach. So there's obviously no ID ban, so we need to do our verbal confirmation of ID, name, date of birth and address, and our verbal confirmation of allergies. And again, checking this against your documentation. There'd be no wristbands. So like I said, normally the patient has diabetes, so there could be a history of some poor blood sugar control, so they could have some high blood glucose. There is always some recent weight loss, and this patient is at risk of malnutrition as well, so there is a must form to complete, and I'm going to go through that with you. Could potentially also have reduced mobility, again thinking about the impact of neuropathy on patients, mobility, sensation, as well. Diet and lifestyle factors to consider. So we know there's going to be risk of malnutrition and the patient's diabetic, so we need to be looking and assessing potentially of those issues. And also, like for all scenarios, we want to be checking social issues, so things around housing, support, how they're managing with activities of daily living. Document your news too, verbalise your score, monitoring frequency and escalation. And then you're going to have a must form, which is going to be completed, and you're going to need to add up the score, verbalise the score, and verbalise your plan of care. You're still going to need to complete your holistic assessment, and that focus should be on nutrition because you've got your must score, and then you're going to end your station professionally. So when you've got these additional assessment tools, such as your must, your 6 CIT in Alzheimer's, and your PHQ-9 in depression anxiety, you need to get through your A2 assessment a little bit quicker because you need a bit more time to complete your scores and verbalise your action plan. So assessment, so what are those physical assessment nursing priorities in your assessment station? Well, like I said, you're still going to do your A2E, airway, breathing, circulation, disability exposure. You are going to make sure in disability you get the most recent blood glucose. And it'd be good here to ask if this is a pre-meal or post-meal reading. So pre-meal should be between 4 and 7 and post between 4 and 9. And you might want to ask a few additional questions around the blood glucose levels. What have they been like? How are what have they been like over the last few months, for example? Are they normally high? Or, what is that blood sugar control normally like for this patient? Remember your news to escalation in the community. So you're going to document and verbalise your monitoring frequency as per the news to policy and the hospital chart, which you will get in your community scenarios. But remember, you're in a person's home. So if the score is 0, you're going to do their monitoring frequency 12 hourly, which will be your next community visit. If they're scoring between 1 and 4, you need to do your monitoring frequency 4 to 6 hourly. You need to ring and speak to a GP today and ask for a review. If they're scoring 3 in a single parameter, then they need hourly monitoring and you need to ring an ambulance and they need to go to the hospital. And again, if they're scoring 5 or above, then again, you need hourly monitoring and you need an ambulance and they need to go to hospital. So just remember your community verbalisation escalation because it's not on your chart because you'll have a hospital chart in your OSCE. Okay, the must chart. So you've done your A2E, you documented your news 2, you're going to move on and complete the must chart. So find it within your assessment documentation. It will have already been completed and carried out. I'm going to show you what that looks like by another nurse. And you are going to add up the scores, verbalise the risk category to the patient, and then use this information to lead into your holistic assessment. So for example, you might want to verbalise something like, Erin, your must score was 2. This shows that you're at high risk, and that's because you've lost a significant amount of weight. Normally the patient has lost kind of 10% of weight in this scenario. So you just want to find out a bit more about that. So can you just tell me a little bit more? If you've got a reduced appetite, are you how many meals you eat in a day and how much of those meals, and what type of foods are you eating? Are you having any difficulties preparing your food? So just ask some more of those questions to find out more about nutrition in your holistic assessment. You also need to verbalise some points which you're going to do on the back of that score. So within your as a holistic assessment, you could offer referring that patient to a dietitian, finding out their food choices, asking them to keep a food chart or a food diary. You're going to verbalise, you're going to repeat the assessment. You're going to do monthly weights in the community. And again, try and find out those underlying causes within your holistic assessment. So a lot of those points there you have to learn anyway for your must clinical skills station, which is a separate clinical skills station. So really good to learn. And also a lot of those points you can put into a care plan on risk of malnutrition. So I'm just going to show you what that must chart looks like now. Okay, so this is just an example from one of my OSCE study books. So I've got all the paperwork in there and explanations for you if you wish to purchase those separately. You'll have this within your assessment documentation. Normally the name, date of birth is all filled in at the top there, but just make sure. And like you'll see, each section of the must will have been scored and circled. So the scenario can be a bit confusing because the patient is obese, but they've had a significant amount of weight loss. So they are still at risk of malnutrition. So the BMI score is 0, so that's been circled for you. You don't need to do anything. The weight loss is normally more than 10%. That's been scored as a 2. Again, you don't need to do anything, just add it up. They don't fall into the category for an acute disease effect score because they are not acutely ill. You're visiting in their home, they're not acutely well, and they haven't had a history of no nutritional intake for greater than 5 days. So just leave that alone. Sometimes nurses panic and think that should be circled, and they circle this step 3, and then obviously it causes a fail. So just add up what's been circled only. So we've got a 0 and a 2. So we'd write our total must score in the bottom here as being 2. And again, at the bottom, we'd write our date, test centre date, the time, and our signature. That's what the must scores look. So if you've got the community scenario, look for this in your documentation. It's a essential part that you need to complete in order to pass this station. And then use that information, like I said, to lead into a holistic assessment and find a bit more out about why they've had so much weight loss, and what is the nutritional situation with this patient, how much are they eating. So other assessment priorities, again, it depends on your time. You won't have a huge amount of time to do an in-depth assessment, but like I said, we're going to assess the recent weight loss, diet, and offer any health promotion advice around correct foods and quantity of foods and type of foods. We might want to focus in on those blood glucose levels, like I said, checking in that taking medication, that the patient has a good understanding of their diabetes, and importance of balanced diet, exercise, medication, keeping high sugary, high fat foods to a minimum. There might be some mobility issues, so just bear that in mind. And the patient might have pain as well. If they've got neuropathy, nerve pain in the feet and legs, then that can be very uncomfortable. So you've got lots of things there you can potentially pick up on. Again, psychosocial, so focus on the social assessment. So evaluate the living situation, how that person is coping by themselves, with any access to resources, any support systems they might need, and always check in on their emotional well-being. So if they're feeling low in mood or anxious or worried about anything, and offer support and referral if the patient consents. And then just your spiritual and sexual. So again, assess if they've got any spiritual or cultural needs that they need any support with within the community setting, and just find out, who's their support network, who's the most significant people in their lives, if they've got a wife, husband, good supportive relationship. And that should complete your holistic assessment. So care planning, so you absolutely want to write a risk of malnutrition care plan here. It's what is expected because you've got a high risk score of 2 and you've got your must. So I'm going to go through briefly what that care plan could look like. So your problem would be, for example, Erin is at risk of malnutrition due to recent weight loss and a must score of 2. So I'm using that must score that I've got from my assessment station into my planning. My aim is going to be to increase Erin's nutritional intake, maintain a normal weight and BMI, and to prevent further weight loss. Re-evaluation time is going to be 7 days. Remember, in a community setting, and also nutrition is not going to change dramatically in 24, 40 hours. We want to re-evaluate in 7 days. What are possible interventions? So we're always going to explain the plan of care and gain consent. We're always going to be monitoring news too with every visit. We want to ask Erin to keep a food diary so we can see what type of food and how much she's eating, and review this on the next visit. We're going to continue to reassess the malnutrition using the MUST screening tool. We're going to assess for underlying causes of reduced food intake. We're going to weigh Erin monthly in the community as per the MUST guidelines. We might be administering some prescribed medications or nutritional supplements. We're going to educate Erin on the healthy, balanced food choices, which are high in protein and low in sugar. We are going to refer Erin to community dietitian, and we're going to escalate to the GP as well and document all care. So this is some examples there of what you could put into a malnutrition care plan. Other care planning things for the station. So again, there might be some mobility issues. You might want to write one on blood glucose control and thinking about educating Erin to be able to manage her blood glucose control better. And there might be pain as well. Pain is a good care plan to prep for all your scenarios, if it's appropriate to this scenario and your patient has got pain, then that is something you can write about as well. Implementation, so some key drugs to read up on in the BNF. So obviously your key diabetic medications, which we have as metformin and glycoside. So read up on those. There's most probably going to be some form of analgesics, so your standard things such as paracetamol. And in the NMC exam, the patient is normally on losartan. So this is a hypertensive medication, so for hypertension, but it's particularly used in patients at risk of diabetic nephropathy, so when that damages to the kidneys. So those are key medications to learn: metformin and glycoside, paracetamol and losartan. Look them up in the BNF, become familiar with them, learn a couple of key side effects and check for any contraindications. Evaluation, so it depends who you're handing over to. You might be handing over to the other community nurse, you could be handing over to a GP, you could be handing over to a diabetic specialist nurse or a dietitian. So obviously read your scenario, make sure you are picked, you know exactly who you're handing over to. So I'm just going to go through the recommendations because all the other parts of your SBAR, you'll have that information within your assessment planning and implementation documentation. So key recommendations, so our main area of concern is the MUST score of 2 and the greater than 10% weight loss, which is a significant weight loss. So we'd want the maybe following nurse to continue to assess the MUST, to continue to monitor patient's weight, to review and assess that food diary, again, to assess and review the blood glucose control and provide any follow-up education. If we're worried about mobility and risk of falls, we'd want them to follow up with assessment of mobility as well. Continue to administer any prescribed medications. And if we've made some referrals, for example, to the dietitian, diabetic nurse or physio, we'd want to follow those up as well. So my top tips for this station is do some background reading on the management of diabetes. You can use the NICE guidelines. Familiarise yourself with the MUST score and appropriate referral and action plan. And that copy of the MUST form, which I showed you, is in the NMC supporting documents PDF. Practice your care plans, specifically for risk of malnutrition, that is expected in this scenario, and review and learn your key medications. So I hope you find that helpful, and please like, subscribe and share my videos. It really helps, trying to provide loads of free advice for you. Share them with people who are studying with the OSCE. I do one-to-one or one-to-2 or small group tutoring, online and in person. You can go over to my website, nursetutor.com, or head over to my socials, Facebook, Nurse Tutor, Tutoring with Hannah, or Instagram, or you can drop me an email, hannah.outlames@outlook.com. I do really flexible sessions, can do from an hour to a full package of training. Can do mock OSCEs, and I do a lot of help for people who are on their second and third attempts and are trained elsewhere and coming for specific guidance for their resits. So please feel free to drop me an email.